You ready?
Yeah.
Let's do it. We have never recorded anything with
No,
you.
we haven't. No.
We've talked about it a bunch of
We've always
times.
talked about it because I have really good cracks.
Yeah. Well, we're finally here on YouTube. What's up, guys? Dr. Nick from Foundations Chiropractic in Cedar Park, and I have a friend of mine with me, Mackenzie. You go by Mac though, right?
Yeah,
The real ones call you Mac.
That's right.
That's right. Cool. And she's a nurse, in case you couldn't tell. She wore these just so you guys would believe her.
Yeah, absolutely.
That's right. But I feel like you're always coming in telling me something about crazy about the nurse life. I know y'all are nurses out there, are hardcore. You guys work around the clock, but you're also doing things like lifting people out of bed.
Oh, yep. All my max times 2 patients, dead body weight. Mm-hmm.
Yep. So you're feeling it, and you feel like you need the care.
I do.
Yes. What do you typically feel out of curiosity? I mean, I have experienced chiropractic for a long time, so the question's not for me, it's more for them. But I'm curious, what do you feel like when you know you need an adjustment?
I can always tell like my back will get really tight and then it's really sensitive, especially my lower back, because a lot of times we're standing for 12 hours. So everything kind of just compresses.
Yeah.
And then like you said, when I'm transferring patients, it's a lot of my body having to do the work because to make up for the patients not being able to.
Right.
And so I can start feeling like aches and tight spots in my lower back throughout the day. Usually after lunchtime, I'll start feeling a little bit more slower and a little tighter. So.
And do you notice, let's say you're about to go get adjusted, and then you go to work, do you feel less achy, more energy, those sorts of things? Like
After I get adjusted?
Yeah, after you get
yeah.
adjusted.
Usually right after the session's over, I'm walking out here feeling like my head weighs 10 pounds lighter.
10 pounds lighter, nice, nice.
And I'm like, oh, I feel taller.
Yeah, cool. So yeah, we'll just go through a typical office visit, show what that looks like.
Cool.
And you were saying you stored up the cracks for me for today.
Yeah, I'm hoping that they will actually work.
Cool, I'm sure, cool. When you're ready, let me have you go face down. If that mic is ever in an uncomfortable position, just let me know. So you had some sort of test today?
I did. I had a lab exam for trach care.
Okay.
And then I had my ATI exam today, which is like...
What's ATI?
It's kind of like a cumulative test, kind of like the START exam, but basically go over what we already know.
Yeah.
It's very interesting of an exam. Not my favorite.
What's the trach test? Like a trach, you gotta know how to do like tracheotomy, or like what's?
Like how to clean the trach, like you take it out, clean the dressing, and do suctioning and all that stuff.
Gotcha.
That looked very tight.
Yes. Have you ever done one?
The trachs?
Yeah, the trach.
No, I typically don't handle them as much on the job.
Okay. Because that's what it's. It sounds like an instrument that is named that, but isn't it also like when someone's like aspirating or they need another way to breathe? You basically
Yeah,
take an
that
incision.
is the tracheostomy. Yeah.
Yeah, got
We
it.
call it the trach just to make it
trach.
shorter.
But you've never done one before.
No, I
But
can't.
you've seen it.
As a nurse, you can't.
You cannot do it. Got
I
it.
think it would have to be like an emergency trauma nurse or like an
Yeah.
ICU trained, but it's typically a physician doing it.
Gotcha.
But you have to care for it as a nurse
100%.
because it gets really nasty.
Yes. No, I'm sure.
Gross.
Okay, so yeah, a little more motion here on this left hip, but this one's stuck.
Mm-hmm.
Yeah. So we're gonna give it a run now. Alright, go ahead and lay it on your side, this side up, you know the drill. Facing that way. Yes. Alright. Good. I'm gonna let that drop back in. There you go. Nice breath in. And let that go. Good. A little bit of you, a little bit of the table on that one. Face this way. A little more on this one. Nice breath in and out. There we go. Go face down again. Good. Better. I'm gonna do a little more here. Nice breath in and out.
That doesn't look good.
Good.
I feel like the curvature of my spine just changed.
100%. Yeah, that's one of the things that usually cues me in. I'm like, man, you're like really like slouching here, not like you, just like that area of your spine. And you can feel the tension when you are. And then I got this upper back though, so tight. This is tighter than usual for you.
I know.
Especially on that side.
I know.
Uh-huh.
Happens when I don't come in for like a month.
Lay on your back, face up. Yep. Take your arms here. Cross them just like this. Nice breath in. Let that go. There it goes. There you are. I'm gonna move this up a bit, okay?
Mm-hmm. That was a good one.
There we are.
That was the moneymaker one.
One of the areas on your body you really like to get adjusted is
My feet.
feet. I know only chiropractor. Am I your only chiropractor ever? Have you seen chiropractors before me?
No, just you.
Okay. I was gonna ask if anyone's ever adjusted your feet before.
No, sure he tries though.
Does he try?
Yeah, he fails every time. He ends up like pulling me down the bed. I'm like, ow.
Yeah. That's funny. Alright, so your foot here, higher up, this is not an ankle adjustment, this is a foot adjustment. I can tell where it needs to be adjusted by the range of motion decreasing. And in the foot, there's supposed to be this kind of like windshield wiper effect that I'm feeling more of here, less of here. That has to do with the tarsal bones in the middle of the foot. Ankle bending. Ooh, this one's not though. You feel that?
Yeah.
Yeah, so I'm gonna do an ankle adjustment here in a moment, but I'm gonna do the foot here first.
Okay.
We'll get this nice and close here, get them cracks in there. Cool, nice. Easy one. Good. Like there's more there. Good. This ankle's gonna explode.
Probably. Oh, yes.
Nice. Little foot too. There it was. Right, go ahead and sit up for me, please.
My cracks are being disappointing today.
I feel like they did alright, but yeah, sometimes it's just
Sometimes they're just like
insane. Yeah.
And I'm always like, it's the one time that we don't put
Yeah,
the
right.
mic on.
Yeah. Your body was shy today.
I know. I thought you were gonna be bad at it.
Check the jaw. Jaw doing okay?
Yeah.
Open. Close. You okay if I do a little bit on the side?
Mm-hmm.
Let your head drop down toward me a little bit and then start opening. Stop. A little bit. One more time. Good. That's been pretty good lately. Close. Open. There we go.
Perfect. Thank you.
Yes. Stand up, move around. Let me know how you feel.
Oh, I feel taller
You're taller.
and lighter. My
There
head.
we go. There we go.
My head doesn't feel like it's like.
That's
right.
Yes. Feel more aligned.
Love it.